Funding for the Maddy Report is made possible by grants from the California Emerging Technology Fund, leaders in the quest for digital equity. The James Irvine Foundation, committed to a California where all low-income workers have the power to advance economically. Fresno State Associated Students, Inc., students serving students. BNSF Railway, moving our economy for 160 years. And The Wonderful Company. The Maddy Report is also made possible thanks to contributions from Harris Ranch Inn and Restaurant and E&J Gallo Winery. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Over the last 20 years, the number of hospice providers in the United States has roughly doubled, while Medicare spending on hospice care has grown from $3 billion in 2000 to over $22 billion today. More than 1.7 Medicare beneficiaries receive hospice care in over 5,000, with over 5,000 providers, the vast majority now being for-profit operators. And nearly a quarter of those beneficiaries live in California. Sadly, mismanaged pain medications, neglected infections, missed nursing visits, incompetent or dishonest home care providers all dramatically affect the most vulnerable among us. A recent report by the California State Auditor shed some unflattering light on the state's oversight of hospice agencies. Our guest is Michael Tilden. He is the California State Auditor. Welcome to the Maddy Report.
Thank you. Glad to be here.
So, let's start with some of the basics. Can you briefly explain, how the hospice care system works in California? Who qualifies for hospice care? What is hospice care? Who pays for it? Those kinds of things.
Sure. So the hospice care basically it's end-of-life care for individuals that typically have some sort of a terminal disease and are really expected to, not live past the next 6 months. So it's really a very important program, especially considering the aging demographics of Californians. Basically what it does is under hospice care, if individuals have, like I said, some sort of an illness or disease, they're not expected to live past 6 months, they get hospice care. And basically what this is, it's an interdisciplinary team that provides medical care, provides comforts, medications, counseling to basically ease that sort of end-of-life process.
Yeah, in full disclosure, as we were talking before we started this segment, my mom was in hospice care for exactly 6 months before she passed. And it was tremendously comforting, not only to her, but to the family. So a very significant thing for a lot of folks. Now, there's supposed to be some state agencies and federal agencies that regulate this industry, the hospice care industry. So who are the licensing and oversight agencies?
Right, that's a great question. So here in California, the number one state department that's responsible for licensing and overseeing the hospice providers or the hospice agencies is the Department of Public Health. And they are the ones that have set forth requirements and actually license hospice providers. The other thing to note, though, is that most hospice care in California is paid for through the federal Medicare program, which is obviously overseen by the Center for Medicare Services, CMS. And I would also add that there are also individuals here in California, low-income individuals primarily, that also can qualify for hospice services through the state's Medi-Cal program. And because of that, the State Department of Healthcare Services also has some responsibility to ensure that there's no fraud occurring related to hospice providers that are using Medi-Cal money.
That kind of begs the question: how effective have these state agencies been in regulating this industry and protecting people from fraud?
Yeah, unfortunately, we noted a number of concerns in that area. For one thing, the Department of Public Health, they really don't do a whole lot to vet the hospice agencies that are applying for licensure. Their process of vetting those applicants is very cursory. It's not very robust. They don't verify qualifications. They don't verify medical licenses. And the other big thing is, in terms of some of the other players here, you've got healthcare services and public health. They have different roles in terms of overseeing the provision of hospice services here in California, but they don't really coordinate their efforts.
Yeah, that's obviously problematic. You want the left hand to talk to the right and know what the right hand is doing. Let me ask you this: has the state taken any steps to address this issue of hospice fraud?
So far, there have been some investigations that have occurred. I know fairly recently the Department of Justice conducted some investigations of some individuals in Southern California for allegedly committing hospice fraud. But I think from what we're seeing, given the growth in the number of nonprofit hospice agencies and the fact that they are all grouped in very tight areas in Los Angeles County, we think there's a lot more that needs to be done here in terms of state oversight.
That's what we're going to talk about next. We're going to talk about some of the key indicators of hospice fraud. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. We're talking with Michael Tilden. He's the California State Auditor about a recent report his office issued on the licensing and oversight of hospice agencies. Your report mentions that hospice locations may be an indication of possible fraud. How so? And have the federal and state regulators gotten wind of this?
Yeah, we definitely noted that location plays a big part here in California. When we look at the growth in the number of hospice providers over the last 10 years or so, the growth has been disproportionately high in Los Angeles County. Just to throw a couple numbers at you, when you look at California overall, back in 2010, there were only 206 hospice providers. Fast forward to 2021, there were 900. So that's a 383% increase, which is pretty substantial. But when you isolate just Los Angeles County, the growth in hospice agencies in 2010 have gone from 109 to over 1,800. So that's a 1,600% increase. And that really doesn't correlate at all with the only 40% increase in the aged population in LA County.
Those numbers are crazy. Those are really high numbers. It's just there's no connection between the elderly population and the number of hospice agencies. So it obviously raises at least a yellow flag, if not a red flag. You indicated there were some other indicators of possible fraud in your report. You talked about live discharges and long duration of cases. Can you explain how they're problematic and what's the likely cost to the federal Medicare program and the state Medi-Cal program?
Sure. I mean, the idea again is that for someone to qualify for hospice services generally means that you're at the end of your life and you have 6 months or less to live. And so you would expect that patients receiving hospice care would generally not be discharged while they're still alive. In fact, nationally, only 11% of hospice patients are discharged while they're alive. And there could be different reasons for that. They recover, they decided they wanted to choose a different hospice provider, whatever. But when you look at Los Angeles County, the live discharge rate is 26%. That's almost 3 times higher than the national average and is also twice as high as the average in California. Related to that is the average duration of services. Nationwide in California, it's about 75 days that somebody is in hospice care. In Los Angeles County, it's 89 days. And some areas in Los Angeles, it's over 100 days.
Yeah, and the other thing that I also noted in your report was the total amount paid per patient. In California, it's basically the same, about $13,200, but in Los Angeles, $15,200. So someone's making money here. The LA population can't be that much different than the rest of the state or the rest of the nation, for that matter. Let me ask you this. Your report also says that some hospice agencies are getting licenses and billing for services despite the fact that either A, they don't have administrators with medical licenses, or they have those person at least on record with these medical licenses. But they're spread over so many hospice facilities that there's no way possible that they're going to be able to provide any meaningful oversight. How is that even possible?
Right. That's one of the key issues here, I think, is that in terms of the oversight we talked about a minute ago, is the Department of Public Health, when a hospice provider comes in and is seeking a license, the Department of Public Health, they're not doing any analysis to determine whether there's the need for those services. They're also not vetting those applicants to determine whether they have sufficient staff to provide services for that region. And they're also not doing any comparison or checking of the ratio of nurses to patients.
Yeah, and I've seen that. Even my mom was in a long-term care facility. It was a nursing home, and so she was able to basically stay there in her same location. But there always was a question of the staff. Was the staffing appropriate? There's one thing I frankly not even having, before this report came out, was I was paying attention to just trying to take care of my mom to make sure they had adequate medical staff to deal with that, medication management and all the rest, because mistakes are made. I'll tell you that if you're not paying attention about your loved one, chances are they could be making a mistake. Let me ask you this. What are the different types of fraud that you're seeing?
I think there's different things occurring. One of the things that we talk about in the report is that when you look at some of these numbers and you look at the number of hospice providers, particularly in Los Angeles County, compared to the aged population, it would appear that each one of these providers, it would really be seeing very, very few patients per day. And so what that suggests is that either they are providing services to patients that are way outside their service area, in some cases hundreds of miles away, and or they have enrolled patients where they're actually not providing any services at all.
Right, and that's the whole point, right? So they're signing people up, but they're not providing the services. Anybody go to prison for this?
Not that I know of. As I said, there have been some investigations, even some very late-breaking investigations towards the end of 2021 and 2022. I believe those investigations are ongoing, so we'll have to wait and see.
Okay, well, up next, aren't there state agencies that are supposed to protect the public from hospice care fraud? What are they doing? What aren't they doing? That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. As California's population ages, so does the demand for hospice care. We're talking with Michael Tilden. He is California's state auditor about a recent report they did on oversight of hospice agencies or the lack thereof. Your office concluded that the state's weak oversight of hospice agencies has created opportunities for fraud and abuse. And I guess where you start is at the beginning, right? The licensing of these agencies. Aren't there regulations in place for licensing standards for hospice agencies?
Well, Mark, that's one of the key deficiencies that we noted in our report, is that even though the Department of Public Health has had the ability since, I think, going back to 1991 to establish regulations that would govern the licensing of hospice providers, they've yet to issue those regulations. And I think as a result, their process of issuing licenses is really lacking. They're not doing a good job of conducting criminal background checks of key personnel. They're not verifying the need for hospice agencies and proposed locations. They're not taking a look at the size of a hospice providers or a potential hospice provider's service area, or looking at their nurse to patient ratios. And again, I think part of that is because none of that stuff is spelled out in regs.
Yeah, it's amazing. Since 1991, they haven't gotten it done. And those are all the things that you just mentioned. For example, nurses to patient ratio. That's really important stuff. And by the way, when people are getting this care, it's not inexpensive. It costs a lot of money. So you're expecting the service, and maybe people aren't getting this. Your report also notes there are some places where the Department of Public Health's licensing falls short, and that directly impacts the quality of hospice care given to the patients. Can you explain that in more detail?
Yeah, again, I think I touched on a couple of those things, is that there are certain documents and requirements that hospice provider candidates have to meet to get a license. But the problem is the public health doesn't necessarily verify that information. Again, I think it'd be really important to conduct criminal background checks of key personnel. That's not really happening. I really think it would be important for public health to, as other states are doing, including New York and Florida, to verify that there's actually a need for a new hospice provider in a particular region. That's not happening. Another thing I haven't talked about yet is the idea that we are finding that there are certain individuals that are listed as a medical director or administrator of multiple hospice agencies, which again suggests that either their identities have been stolen or they're stretched too thin to provide quality care.
Yeah, and that's the other issue, right? You have these people spread out over. I think I read a report in your report, like 27. One person was doing like 27 different hospice facilities, which is impossible. There's no way they can make sure the staff is doing what they're supposed to be doing. So you then have people giving medical care that have no training in that area. Really, really problematic. So what about the state's ongoing, forgetting the licensing for a second, what about the ongoing monitoring of state agencies, of hospice agencies?
That's another real deficiency, I think, in the state's oversight of these hospice providers, in that once they get a license, there currently is no requirement that public health conduct ongoing inspections of the facilities or the operations. Basically, their policy says that they may conduct those activities, but without a requirement, it's obviously not happening consistently.
And that license is good for, I think, for 24 months.
Correct.
Yeah, and so and no oversight. It just they do it and they go. And by the way, even that initial oversight and licensing, it's problematic there as well. Let me ask you this: there are different hospice agencies can have this thing called deemed status, which I'd never heard of before. Those apparently are hospice agencies that are inspected by a federally approved accreditor, and about 50% of California's hospice agencies have that. Are they doing better?
So that's another real significant issue. I think one, from what we can tell, there's a disproportionate number of complaints that DPH is receiving about hospice providers that have that so-called deemed status. The other real issue that we have there is that public health is not really getting reports from those accreditors in terms of their initial site visits, any ongoing inspections. That they're really not overseeing that at all, even though their contract would allow them to get that information.
So that lack of oversight, the lack of the left hand talking to the right hand, knowing what the right hand's doing, a real problem here. If you've got half the agencies that are being accredited by this different group. What about the Department of Public Health? How are they following up on complaints?
Again, that was another area where we thought we saw the oversight was really sort of lacking. A couple things. One, we found that they really haven't set adequate requirements in terms of how long it should take them to complete investigations. And I think because of that, we found that their investigations often are not timely. We also found that they're not thorough. And oftentimes, when they are unable to substantiate an allegation, they don't really clarify whether that's because they looked at sufficient evidence and determined that the allegation was unfounded, or whether there just wasn't sufficient evidence to make a determination either way.
Yeah. So obviously another problem. We talked about the lack of coordination between state agencies in this process in terms of oversight investigation. But I want to ask you this last question. That is, what about the penalties for violations? Are they sufficient?
No, that's another area where we thought there's some problems. Number one, there isn't any. I think the first thing to say is that Department of Public Health, in our opinion, one of the strongest mechanisms they have to sort of police some of these bad actors is to suspend licenses, revoke licenses, or deny applications. That's something that we found has very rarely occurred. They also have not established any statutory sanctions or monetary fines for any violations.
Right. So if you're not penalized, you're probably not going to worry about it if you're one of these agencies. Right. Up next, we're going to talk about how do we improve the hospice agency oversight in the state. That conversation in a moment. This is the Maddy Report. Welcome back. I'm Mark Keppler with the Maddy Institute. We're talking with Michael Tilden, who is the California State Auditor, about hospice care and the fact that their office recently issued a report that was frankly critical of the state's oversight of hospice agencies. So, Michael, if someone's concerned about hospice care for a loved one, and I think a lot of people out there probably are, where can they go to get information regarding complaints against a hospice agency or the results of any fraud investigations?
Sure. The California Department of Public Health, they do have a website that the public can access. It's called Cal Health Find. And it's supposed to include information on licensing status, any complaints, like you said, the hospice agency owners, any substantiated complaints. Unfortunately, we found that it contains information that hasn't been kept up to date in terms of ownership, licensing status. So it's not super reliable from that standpoint. Also, it includes, in terms of complaints and investigations, it has a category of unsubstantiated complaints, but it doesn't really differentiate whether they were unsubstantiated because they reviewed the evidence, found that the allegation was unfounded, or they couldn't draw a conclusion because of a lack of evidence. So it's not that's the website.
That's pretty important, right? I mean, it's a pretty important distinction. So what is your office recommending? I guess you're making a whole series of recommendations in terms of actions to address these problems, particularly the egregious instances of hospice fraud when it comes to licensing, oversight, enforcement of regulations. Can you talk a little bit about some of your recommendations?
Sure. As you said, we have a number of recommendations in the report. Most of our recommendations are aimed at the California State Legislature to require Department of Public Health, healthcare services, and in some cases, other state entities to make some changes to improve the oversight here. One of the key things, though, is we have a recommendation that the state create an interdepartmental task force with the Department of Public Health, healthcare services, Department of Justice and Social Services to really investigate and prosecute any fraud or abuse by hospice agencies, particularly in LA County. We also believe that they need to establish a permanent working group to perform annual risk assessments to take a look at growth in the number of hospice providers, any clustering by different locations or regions, and any instances of medical personnel that seem to be working for multiple agencies. We also think that the legislature should revise state law to really require hospice provider candidates, when they apply, to demonstrate that there's an unmet need for their services in that particular region. Also, going back to the emergency regs I talked about a little while ago, we have a recommendation that DPH establish emergency regulations that would provide information on requirements related to patient care that we talked about, related to facility oversight and tightening up their process for issuing licenses and conducting follow-up investigations.
By the way, just I want to mention something. That one of the things I saw in your report was you wanted them to revise the law regarding, quote, good moral character. So it's one of the things, one of the criteria for selecting or proving a hospice agency is that they have, people running and have good moral character. I thought that was kind of interesting. There's really no definition there of what that really means, right? And that needs to be tightened up.
Right, I agree. And I think for us, at a minimum, they need to revise the law to require background checks of the key personnel that would work for these hospice providers. They need to establish that requirement.
Yeah. And there's nothing about, we talked about deemed status agencies, hospice agencies. I mean, something needs to be done there as well, right?
One of the key recommendations we have there is that Department of Public Health needs to increase their oversight of these accreditors and these deemed status hospice agencies. And basically what they need to do is they need to start collecting the reports, the investigations, the site visits from these accreditors, and start reviewing that information and taking any appropriate action.
It seems important because almost 50% of the hospice agencies are these deemed status agencies. Let me ask you, we've only got about 20 seconds left in this segment, but I just want to ask you real quickly. A lot of the agencies are complaining about insufficient staffing. They can't do what they're currently being asked to do because they have insufficient staffing. Now you're asking them to do all these other things, including, by the way, improving their website. Isn't that really fall back on the legislature to allocate more money so they can have, these agencies can have more funding to do these things?
That really depends, Mark. I mean, right now there is a moratorium on issuing any new licenses, and that moratorium is going to last for a year after the date that we released our report. So I think when that moratorium expires, I think public health is going to have to step back and do a staffing analysis. It's going to depend on their work.
No doubt about that. Well, I want to thank Michael Tilden, California State Auditor, for being with us today. This is Mark Keppler for the Maddy Report. Thank you for joining us.
The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.org.